Hi, I'm Mark Raven. Welcome back to part 3 of our video discussion series on lean design in healthcare. We're back with our guest Miguel Burbano from the Neenan Company and Dr. Randall Huss from the St. John's Clinic, Rolla. In this segment today, we're going to be talking about getting physicians and staff members on board with process and workflow changes that tied into the physical space design. And both of our guests are also going to talk about some of the results of this new construction, both for the organization and for the patients. Miguel, since the space and the workflow both changed, can you talk about how you worked with the staff members and leaders in terms of the iterations of coming to this different design and different way of working? Was there any pushback or were there any concerns? How did you address some of that?
It's a wonderful question, and oftentimes I'm going to be with Dr. Huss later next week, and we always wondered. I wish I could tell you it was a deliberate outcome. We had resistance. Staff, everyone is resistant to change. We're timid about it. We do not understand what we are about to be challenged by. There's internal conflict as well as organizational conflict. So line managers could see that they would have loss of turf, loss of domain, and they would resist the change. Physicians would be concerned with the new technology, and could they interact with computers? Could they interact with this new technology? And they would resist the transformation. Patients, in many ways, you perhaps can remember when the airlines introduced the kiosks versus the airline agent. Similar sort of thing. You know, I remember being terrified as a passenger of, I need a human, I need a human. Well, today everybody uses the kiosks, and we are all actually quite pleased. We'd rather deal with the kiosk with a moody person. So in a similar way, I think the resistance to change was, I believe, more lack of information. Is almost always lack of information. So we focused on providing ample information, digital models, a lot of simulations were provided, and a lot of study was done involving all the staff to overcome those changes and those fears, if you will.
Well, I think first off, the doctors got the lean concepts pretty well. They seemed to embrace lean pretty easily, and they saw the efficiencies that this was able to provide us. The key really was lots of communication, and also a tireless champion. In that case, that was me, working to promote a vision that was a consistent vision of better care, more efficiency, etc. So we had a lot of meetings. It was a constant item at every quarterly physician meeting we had. We had some extra meetings too with Miguel and the design team. We also included the doctors and the co-workers to every extent possible in the design process, particularly as it related to their particular space and their particular needs. But as far as things like the individual physician office, I challenged our doctors. What did you use those offices for mostly? And they all first admitted they rarely used their individual offices. I said, well, don't you mainly use them to hide that stack of paper records that you haven't gotten to yet with all the messages, etc. And also, you use it because you've got all your medical school books and old references on this bookshelf that you'd never really think about taking off the shelf anyway because they're outdated now. Well, now, the record is everywhere there's a computer, and so you don't need to worry about the stacks to hide the stack. You can hide your stack virtually if you still are, if you're still batching. With regard to references, anything you're going to need is already on the computer. All of our doctors have access to up-to-date online and many other references too. So really, they admitted there wasn't any need. The only one thing that people did, that doctors once in a while did say, once in a while I need the meeting, I need a private place for a meeting with either a patient or a family, or maybe the newspapers come to interview me or something like that. Or maybe an interview like this. Well, my response to that was, there's a door on this sliding. We use the barn doors in places to save square footage, so that you don't waste square footage with the door swing. And this was one of the areas. that we use the barn door concept. So we just slide the barn door. It's got windows on it, but you slide it closed, and we put a little slide on, a little slide that you can move across that says "Do not enter." Yeah. So for the time you need it, for your private space, it's your private space, and that seemed to address that issue, because what they got out of giving up the individual provider offices was one more provider in the business unit, and we're on a cost allocation model, as many are, and that's real savings in their pocket every month. That's reduced occupancy costs. So they understood that right away, and so I think that's how we got to that. As far as probably the biggest. Well, I'd start with maybe, or go next to the breaking up the one-to-one physician nurse ratio. Yes, my nurse Becky knows my patients best. Well, our pushback was always, well, we want you to have 5 nurse Beckys, in your team.
Looking at the construction process itself, what were some of the results or some of the savings and benefits that you think came from this lean process?
Yeah, the Neenan Company, by bringing, we call it the 15%, we spend a lot of resources in the first 15% of the schedule of a project, the duration of a project. In other words, we advance forward as many disciplines as is possible to the forefront of a project in order to avoid late decisions. By involving all stakeholders earlier in a project, we are able to resolve potential future issues with everyone's participation. Secondly, we believe on just-in-time delivery, just as we believe in just-in-time design. So Toyota and Lean are distinguished by avoiding batching. We should not wait for everybody to be done with their part, like in an assembly line, only to pass it to the next person down the road. We believe that by eliminating the batching, by constantly improving delivery of just-in-time and not having unnecessary inventories, deliveries can be made better. So the project was built fairly quickly, and it was a speedy delivery, if you will, 12 months, on a very, very difficult site. Why? Because we were able to advance site work, for example, well in advance of the rest of the project. So those sort of solutions brought about savings in money to the client, and they obtained a production source much sooner than anticipated.
Are you able to share what the time savings and the cost savings was?
Certainly, the time savings, we believe that the project was probably 4 to 6 months faster in delivery than the traditional delivery. That's an easier one. In terms of cost, we believe, our company believes that our construction, or the integrated delivery, saves clients 10 to 15% of the total project cost. Can we ground that number more specifically? It is very difficult because comparisons are seldom oranges, apples. The data is all over the place. However, in the case of our repeat clients, we are able to compare. And in those cases, we have had evidence that it's about 10 to 15%. We believe that the project, compared to the less lean solution of the first effort, saved the system around $3.5 million. Okay. That the occupancy cost reduced by about $500,000, obviously the interest rate on that space, and that the operating savings to the project were around $110,000, more or less. That'll be per year. And I'm sure that they have better data now that the building is open 1 year.